So today we're talking with Dr. Eric Jarvis, who is an assistant professor of psychiatry at McGill University and also a staff psychiatrist at the Jewish General Hospital, and we'll be talking about religion and mental health. We're sitting in a building doing this interview called the Jewish General Hospital. That religious organisations have played a key role in the provision of services which have now become mainstream. That a lot of the original asylums were founded by religious congregations. I mean, the Douglas Hospital in Montreal, the big psychiatric institute, used to be called the Verdun Protestant Hospital. The Louis H. Lafontaine, the other big one, used to be called St. John.
So the foundations of our society really are religious, and it's just in modern times we've raised questions and concerns of the traditional religions that have caused this profound questioning. I think of all of us, what's the role of religion in society and in professional life? How much of it should we completely cut off? How much of it should be disparaged or actively opposed? And now the new question is, how much of it needs to be brought back? Because we've lost something fundamental to our own identities.
Could you give us a sense of how big this field is of religion and mental health in the wider scheme of psychiatry?
Well, this is a much smaller part of psychiatry than, say, psychopharmaceutical or mainstream psychotherapies would be. So it's really something that's coming back into being important, recognized as being important over the last 15, 20 years, and something that I anticipate will gather momentum in the future. Okay. Modern psychiatry, beginning over the last century or longer, as you say, has really undermined, I think, some of the traditional ways of understanding morality and the traditional ways of framing life experience, and with the many benefits that have come to people through modern psychiatry and medicine, I think that this is one of the downsides that we've seen. And so some of the patients that I see who are suffering the most from debilitating mental illness also have a lack of coherence or sense of identity or place in the world or place in the universe, for that matter. And so a religious structure can give a lot back if it's allowed to take root in the therapeutic process. And so I would agree that this is important to do, and how this can be fostered in a psychological or psychiatric setting would be to show respect to a person's religious beliefs, and there has to be an appropriate integration of religious belief and practice, given the limitations that a person may have, but that a practitioner, by paying attention to those and by fostering those relationships and those practices, beliefs, can really give something back, can restore a sense of identity, coherence, and meaning where there has been none.
But I think it is a kind of real problem, the trying to integrate how to access or elicit and work with religious ideas and a patient, and to harness those ideas so that they help in recovery. And I think there's a lot of stereotypes, some of the vestigial ideology of the past comes in, so people will often say, oh, we can't talk about religion because we'll be considered to be proselytizing, and
it's taboo.
It's taboo, and but then you think, well, if you're a psychiatrist or a psychologist, you talk about sex, you talk about how people spend their money, you talk about all these other subjects which you don't normally talk about in general conversation on the bus. So is religion really any difficult to asking people about their sex life, their accounting, how they spend their money, bipolar patients, suicide?
And people do ask me about my religion. They'll say, well, what religion are you? Are you Jewish? Are you something else? I heard you were Latter-day Saint. So you kind of negotiate these things the best that you can, given on this. I mean, one other item I could bring up is psychiatrists or psychiatry residents who come from other countries come to Canada and find this a very secular society. They've been used to working with patients in a much more religiously open environment. So they come to Canada, and it's very hard for them to know how to proceed, and awkward. How much, so they really divulge nothing at all. If they can, although some of the residents come, they wear religious clothing or garment, and so it's not, they can't exactly hide their religious identity, but how to bring this up, I think there's very little training provided for what to do and how to respond to questions that are asked.
Could you give any examples of good practice or best practice, or either individual clinics or groups or spiritual organizations which work with people with mental health problems or in psychiatry?
What we do at the Jewish General Hospital where I practice, in the cultural consultation service, is we make an extra effort to inquire, first of all, about religious belief and about religious practice in the patients that we see. And that's a beginning, because I think often it's not discussed in any way in consultations or assessments in psychiatry and psychology. Then we go out of our way to try to include members of the community that could even come into the consultation, to the consultative process. I think our goal is to be respectful, not to be inappropriate in our responses, but to be available to people, to try to transmit a little bit of that respect for things that may be sacred, respect for, like you said, sacred texts, and for the role that they have in people's progression in their lifetime. I think that's a real question for practitioners, and I would hope that more would take this as an opportunity to extend something a little bit different to the people they treat.
Dr. Jarvis, thank you very much for your time, and hopefully we'll come back and interview you again on this or another topic.
Sure.